Bismillahirrahmanirrahim. Dear students, welcome you all to the first lecture of industrial pharmacy theory class. Our today lecture is about the pharmaceutical emulsion. In this chapter, pharmaceutical emulsion, we will discuss in today lecture about the pharmaceutical emulsion and formulation of pharmaceutical emulsion. By completing today's lecture, dear students, you will be able to know about the pharmaceutical emulsion, different types of pharmaceutical emulsion, and formulation of pharmaceutical emulsion. An emulsion is a biphasic system consisting of two immiscible liquids. Immiscible liquids are not blendable or not mixable. If we add water to oil or oil to water and want to mix it, it is impossible to mix these two liquids because of the immiscible nature of these two. Hence, another substance that is termed as emulsifying agent, or a third agent, that is emulsifier or emulsifying agent, is added to reduce the interfacial tension between these two phases, oil and water, and stabilize this system. And such type of biphasic system, which is stabilized by the using of third agent, that is termed as emulsifier or emulsifying agent, is termed as emulsion. In pharmaceutical emulsion, there are two phases, or immiscible liquids. One is water and the second one is oil. Either oil or water is dispersed in the form of small droplets in the second phase, that is termed as dispersion medium. The dispersed phase is also termed as internal phase, while the dispersion medium is also termed as external phase. There is no need of confusion between these two terminologies synonymously used: internal phase or dispersed phase and external phase is dispersion medium. There are different bases for classification of pharmaceutical emulsion. One of the base that is used in classification is based on dispersed phase. As I told you, that dispersed phase is also termed as internal phase. If the droplet or globules dispersed is water, then it is termed as water and oil type of emulsion. In water and oil type of emulsion, water droplets are distributed in the oily phase. The example of water and oil type of emulsion is cold cream. The external phase in the cold cream is oil. Oil is the external phase, water is the internal phase. The second class of this basis is oil and water type of emulsion. In this case, oil is internal phase and water is the external phase. Oil droplets or globules are distributed in the water is dispersion medium. Example of This class of emulsion is milk is one of the most popular example, and vanishing cream, shaving cream are other examples of oil and water type of pharmaceutical emulsion. The third class of emulsion is termed as multiple emulsion. In multiple emulsion, there are two chances, either oil and water in oil or water and oil and water. In the first case, oil and water is distributed in the oily phase, and in the second case, oil and water and oil is distributed in the water. This type of emulsion is used to prolong the release of the drug, that is sustained release formulation is developed by this type of this class of the pharmaceutical emulsion. You can see figure number 1, it clearly explains the various types of emulsion on the basis of dispersed phase or on the basis of internal phase. Either the internal phase is oil or water. On the left side, you can see the first figure indicating oil and water type of emulsion, in which the oil droplets shown as yellowish colored droplets are distributed in the water phase, and it is termed as oil and water. And in the middle, the water droplets are shown as distributed in the oily phase, and it is termed as water and oil type of emulsion. While on the right side, you can see on the top, that is one of the multiple emulsion, water and oil and water type. Water and oil is in the interior shown is further distributed in the water phase, and the last one, that is below this class, is oil and water and oil type of emulsion, is shown in the figure number 1. These are the classes of types of pharmaceutical emulsion on the basis of dispersed phase. Which one phase is dispersed? There are several other bases. For example, based on the size of globules, we can classify pharmaceutical emulsion. On the basis of size of globule, pharmaceutical emulsion are classified into 3 classes. Macro emulsion, first class. The second class is micro emulsion, and the third class, that is the nano emulsion. From top to bottom, from macro to nano, macro is a larger size droplets, micro emulsion has smaller size of droplets, and the smallest droplet size will be, or globule size will be, in the nano emulsion, because nanometer is far more less size as compared to micro and macro emulsion. We can also classify pharmaceutical emulsion on the basis of routes of administration. For example, if we say that orally taken emulsion, orally administered emulsion, parenterally used emulsion, or parenterally injectable providing pharmaceutical emulsion, or topically utilized emulsion. Topically utilized emulsion is injection propofol is a type of emulsion. Orally taken, we can say that phenamine emulsion, that is orally taken emulsion in the market, you can see. And medicated types of creams or ointments, liniments. These are the topically applied pharmaceutical emulsion. Cream is a viscous type of emulsion that I have told you. The examples of the vanishing cream, the cold cream, or the shaving cream. These are the types of emulsion. These are topically applied. Emulsion may be classified on the basis of therapeutic classes, for example, antibiotic containing emulsion or any other type of emulsion that is used for the therapeutic activity, and on the basis of therapeutic activity we can also classify pharmaceutical emulsion. Before going to discuss in detail the formulation of emulsion, I think it is necessary to discuss a little bit about the pharmaceutical applications of emulsion. Although it is not included in the syllabus, not is mentioned in the syllabus, but I think it is necessary to learn about the pharmaceutical application of emulsion, or the pharmaceutical importance of emulsion. But why we are going to formulate pharmaceutical emulsion? The answers behind the logic is that the first reason is that there are several drugs having unpleasant taste and odor, and for masking the unpleasant taste and odor of these drugs, like castor oil or cod liver oil are the example of these such compounds which have unpleasant taste and odor. To mask this unpleasant taste, it is necessary to formulate in the form of pharmaceutical emulsion. The second reason or application is pharmaceutical emulsion can be used to prolong the release of drug, thereby providing sustained release action. Remember that I have told you in the classification of the pharmaceutical emulsion on the basis of dispersed phase, in the third class of that particular classification, that is multiple emulsion. I have told you that multiple emulsion is employed in the formulation of sustained release formulation. The third application is essential nutrients like carbohydrate, fats and vitamins can also be emulsified and can be administered to bedridden patients as sterile intravenous emulsion. It means that in the form of sterile intravenous emulsion we can provide nutritional requirements which is essential for the bedridden patient, for example carbohydrates, fats and vitamins. These can be provided in the form of intravenous emulsion or parenteral type of emulsion. The fourth application is provision of protection to drugs which are susceptible to oxidation or hydrolysis. In this case, there are drugs which needs to be protected from the oxidation or hydrolysis. Emulsion is formulated. Emulsion is the way of the protection from the oxidation or hydrolysis. And the last, pharmaceutical emulsions are used widely to formulate externally used products like lotions, creams and liniments. These are the formulations which are externally applied, and the basic of these formulations are they are emulsions in nature. Before going to discuss the formulation of emulsion, first of all we should know that there are certain ingredients which are termed as active pharmaceutical ingredients. It is necessary for each dosage form to mention the quantity of the drug on the label plate. If you can check any dosage form, like you can orally you can see the orally taken formulation, that is pharmaceutical emulsion in nature, or any other dosage form, you can see the active pharmaceutical ingredient may be one or more than one ingredient which is mentioned along with the name. The quantity that is utilized in the formulation is also mentioned. For every dosage form, it is necessary to mention the quantity of the API. It is one, it should be mentioned. It is mandatory to mention the quantity along with the name. If there are more than one API, that is active pharmaceutical ingredient, responsible for the therapeutic activity of the formulation, it is necessary to mention along with the excipients. Is not necessary, but the active pharmaceutical ingredients are necessary. In some cases, like the sugar free or not sugar free, flavor are mentioned on the label, but the rest of the exceptions are not mentioned in the formulation. Sugar free or non sugar free are necessary because it is very beneficial for the patient, for the most of the pediatric patient. The flavor is mentioned on the formulation to use for the patient. Acceptability is increased to mention this type of the flavor is used in the formulation, especially for the oral formulation. Flavors are mentioned because oral taken formulation contain flavors rather than the other type of the routes of administration. For example, flavors are not mentioned and not necessary for the topical dosage form. There are several properties which is mentioned as ideal properties for excipient, which is considered before selecting any excipient. Some ideal properties include there should be no interaction with the drug. Excipient should be compatible with the drug, that is physical and chemical, as well as the therapeutic compatibility should be there among the excipient used in the formula as well as the active pharmaceutical ingredient. There should be non-toxic and non-irritant nature of the excipient, and excipient should be cost effective, pharmacologically and physiologically inert. If it is pharmacologically active and it is not inert, then it will influence the activity of the formulation. And the excipient should also be effective at low concentration. These are certain properties which is mentioned as ideal properties of excipient. I have told you 6 properties. Lack of interaction with the drug. These are the properties for excipients, on the basis of which we can say that this excipient is ideal. It have ideal properties. Properties, the first I told you that it should lack interaction with the drug, should lack interaction with the other excipient used in the formula. It should be physically and chemically stable, If I use it, it is not compatible. It will also cause problem. If it is compatible with the ingredient but it is not physically and chemically stable, then the formulation stability will be affected. So it is the need to evaluate its physical and chemical stability as well. Non-toxic and non-irritant nature. If I use an excipient and this excipient is cause irritancy to the patient, it is topically applied cream and the cream cause irritation to the patient, and this is not acceptable and it should be avoided. Cost effectiveness is also necessary for the excipient. If it is very much costly, one ingredient that I have selected, on the other hand I have the choice of the economical and effective one, I will prefer the economical and effective one rather than the very costly material and effective. Another properties I have told you that it should be pharmacologically and physiologically enough and should be effective at low concentration. If I have the choice of two emulsifying agent, one is effective at 5% concentration and the second one is effective at 1% concentration, the cost is almost similar, then I will prefer the lower concentration as it is same effectiveness as compared to the higher concentration.